They keep telling you the NHS is underfunded, that there is no money, that we need to make difficult choices. Here is what they are not telling you. The NHS budget is at record highs. The money exists. It is just not going to doctors and nurses anymore. It is going to shareholders in Missouri, private equity funds in London, outsourcing giants that fail upwards. The NHS is not broke. It is being stripped for parts. And in this video, I am going to show you exactly who is buying and how they got away with it. Let's start with what most people believe. The NHS is a public service. It is free at the point of use. It is funded by your taxes and run by the government. When you see a doctor, when you go to hospital, when you call an ambulance, that is the state looking after you. That's the story. And 20 years ago, it was mostly true. Today, it is a myth. The NHS still exists as a brand. The logo is still there. The name is still on the building. But behind that logo, something fundamental has changed. When you visit your GP, there is a good chance the surgery is owned by a private company. When you call 111, you are probably speaking to someone employed by a private contractor. When you finally get that operation you have been waiting 18 months for, it might be performed in a private hospital, billed to the NHS at a premium. The NHS doesn't deliver healthcare anymore. Not really. Increasingly, it just commissions it. It's become a middleman, collecting your taxes, then handing them over to private companies to do the actual work. And those companies, they're not charities. They're not in this to help. They're in this because the NHS is one of the biggest pots of money in the country, over £180 billion a year, and they want their share. This is the privatisation of the NHS, not the dramatic kind, where a politician stands up and announces they're selling it off. That would cause riots. This is the quiet kind. The kind that happens contract by contract, service by service, so slowly that by the time you notice, it's already done. So what's actually been sold? Let's start with GP surgeries, the family doctor, the foundation of the NHS. Surely that is still public? Not necessarily. In 2021, a company called Operose Health owned nearly 70 GP practices across England. Operose was owned by Centene Corporation, an American health insurance giant worth over $40 billion. The same company that profits from America's broken healthcare system was running British GP surgeries. Centene was in charge. They were not the only ones. Other private providers, some backed by private equity, some by international investors, own hundreds of practices between them. Centene eventually pulled out after bad press and political pressure. While they were here, they extracted profit. When they left, chaos remained, with practices struggling to find new providers and patients caught in the middle. And the door is still open. Other private companies are still running GP surgeries right now. The American insurers might be gone, but the model remains. Move beyond general practitioners and it gets worse. NHS 111, the urgent care helpline, is largely run by private contractors. Companies like Totally, Practice Plus Group, and Integrated Care 24 hold contracts worth hundreds of millions. They are paid to hit targets, answer calls within a certain time, and process patients through the system. Whether that actually results in good care is another question. Out-of-hours services are the same story. Private providers run what used to be NHS services, billing per contract and cutting costs wherever they can. Diagnostics and planned surgery are where the money really flows. Waiting lists have exploded in recent years. Millions of people are waiting months, sometimes years, for operations. The government's solution is to pay private hospitals to clear the backlog. Companies like Spire Healthcare, Nuffield Health, and Practice Plus Group now perform millions of procedures funded by the NHS every year. The NHS pays them per operation, often more than it would cost to do the same procedure in an NHS hospital. Think about that. We are paying a premium to private companies because we have let our own hospitals fall apart. Every pound that goes to Spire or Nuffield is a pound that does not go to rebuilding NHS capacity. It is a self-reinforcing cycle. Underfund the NHS, watch waiting lists grow, outsource to private providers, watch the NHS fall further behind, and repeat. Mental health is perhaps the darkest corner of this story. Private equity-backed companies run huge chunks of NHS mental health provision. Names like Signet, Elysium, and the Priory Group. They run psychiatric hospitals, secure units, and eating disorder clinics, all funded by NHS contracts. The Care Quality Commission has repeatedly found serious failures in these private mental health units. Understaffing, poor care, preventable deaths. But the contracts keep getting renewed because the NHS does not have the capacity to do it itself anymore. These are not edge cases. This is mainstream NHS care, delivered by companies whose primary obligation is to their shareholders, not to patients. Even ambulances are not immune. Some trusts have outsourced emergency ambulance services to private firms. Patient transport, getting people to and from appointments, is almost entirely privatised in many areas. Cleaning, catering, admin, IT, patient records are all increasingly outsourced to the usual suspects: Serco, G4S and Capita, companies with long track records of over-promising and under-delivering on government contracts. The NHS has become a shopfront. Behind it is a complex web of private contracts, each siphoning money out of the system. So who are these companies? Where does the money actually go? Let us start with American healthcare corporations. Centene, as I mentioned, owned Operos Health until 2023, but they are not the only United States player. United Health Group, America's largest health insurer, owns a company called Optum. Optum provides data analytics, back-office services and consulting to the NHS. They are embedded in the system, processing information, shaping how decisions get made. These are the same companies that run America's healthcare system, a system where people go bankrupt from medical bills, where insurance companies deny claims to protect profit, where life expectancy is falling despite spending more per person than anywhere else on Earth. And they are now inside the NHS. Why? Because they see opportunity. The NHS is a guaranteed revenue stream, funded by taxpayers, with a government desperate to reduce waiting lists. For American healthcare giants, it is easy money. Then there is private equity. If you do not know what private equity does, here is the short version. They buy companies, load them with debt, cut costs aggressively, extract profit, and sell them on. What happens to the company afterward is not really their problem. Private equity firms like Blackstone, KKR, and Cinven have moved heavily into UK healthcare. They own care homes, mental health providers, GP chains, and diagnostic companies. The business model does not work for healthcare. You cannot cut costs in a hospital the way you can in a retail chain. When you strip out staff, reduce training, defer maintenance, people get hurt, people die. But by the time that happens, the private equity firm has already sold up and moved on. The mess gets left for someone else to clean up. Finally, there are the outsourcing giants. Serco, Capita, G4S. These companies have been failing upwards on government contracts for decades. Serco has a long history of botched government contracts, from tagging criminals who did not exist to charging for work that was never done. Capita ran NHS patient records systems that lost data. G4S provided security so bad that the army had to be called in to cover the Olympics. And yet they keep winning contracts. Billions of pounds, year after year, because once a company is embedded in government, it is almost impossible to get rid of them. They become too big to fail, or at least too complicated to replace. This didn't happen by accident. It happened because of specific political decisions made by specific people. The turning point was 2012. That year, Andrew Lansley, Health Secretary under David Cameron, passed the Health and Social Care Act. It was the most significant piece of NHS legislation since 1948, and most people have never heard of it. Here is what it did. It required NHS services to be put out to competitive tender. Any qualified provider, public or private, could bid for contracts to deliver NHS care. The argument was efficiency. Competition would drive innovation. Private companies would bring expertise. Patients would get better care. The reality, it opened the floodgates. Suddenly, private companies could bid for work that had always been done by the NHS. And because private companies have lawyers and bid writers and experience winning contracts, they often won, even when NHS providers would have been cheaper. The Act also created clinical commissioning groups and later integrated care systems. These sound technical, but the effect was to fragment the NHS into dozens of separate bodies, each making their own decisions about who to contract with. Oversight became harder. Accountability became murkier. Private companies thrived in the confusion. Both Conservative and Labour governments have enabled this. New Labour, under Tony Blair, started bringing private companies into the NHS through PFI ideals and independent sector treatment centres. The Conservatives accelerated it. The current government shows no signs of reversing course. There is also the underfunding question. I said at the beginning that NHS budgets are at record highs. That is true in cash terms, but it is not the whole picture. The NHS is growing, and so are its costs. An ageing population needs more care. New treatments are expensive. Staff need to be paid. When you account for all that, the NHS has been chronically underfunded for over a decade. And that underfunding creates pressure. Trusts cannot afford to run services in-house, so they outsource. Waiting lists grow, so they pay private hospitals to help. Staff leave for better paid private sector jobs, so the NHS pays agencies to fill the gaps. Every cut creates an opportunity for private companies to step in. The crisis is not a bug. For them, it is a feature. You might be thinking, so what? If private companies can clear waiting lists, isn't that a good thing? If they can deliver care, does it matter who signs the paychecks? Here is why it matters. First, money. Every pound that goes to private shareholders is a pound that does not go to patient care. When Spire Healthcare makes a profit on an NHS contract, that profit leaves the system. It goes to dividends, to executive bonuses, to investors who have no stake in whether the NHS survives. Over time, this bleeds the system dry. The NHS loses capacity, becomes more dependent on private providers, and the cycle continues. Second, cherry picking. Private companies take the easy cases, the routine operations, the straightforward procedures, the patients who will not cause complications. The complex cases, the elderly patient with multiple conditions, the surgery that might go wrong, those stay with the NHS. Private providers get guaranteed income for low-risk work. The NHS gets left with the expensive, difficult cases and less money to deal with them. This is cherry-picking by design. Third, accountability. The NHS is democratically accountable. You can vote out the government. You can pressure your MP. You can make noise. Private companies are accountable to their shareholders. If Centene decides to pull out of the UK, they just leave. If a private equity firm strips a care home for profit, there is no one to vote against. The people making decisions about your healthcare do not answer to you. This is an accountability gap. Fourth, the two-tier trap. Once private healthcare is embedded in the system, the next step is obvious. If you can pay, you get faster, better care. If you cannot, you wait. That is not a slippery slope argument. That is what is already happening. Private hospitals that take NHS contracts also take paying customers, and the paying customers get seen first. The same consultants work in both systems, prioritising whoever pays more. The NHS was built on a simple principle: care based on need, not ability to pay. That principle is being dismantled, not by abolishing the NHS, but by hollowing it out until it only serves people who cannot afford the alternative. No politician will ever stand up and say they're privatising the NHS. The backlash would be instant. The NHS is too popular, too symbolic, too embedded in what Britain thinks it stands for. So they don't say it, they just do it. Contract by contract, service by service, crisis by crisis. They underfund the system until it struggles, then bring in private companies to fix the problems they created. They call it partnership. They call it efficiency. They call it patient choice. What it actually is, it's the largest transfer of public assets into private hands in modern British history. And it's happening right now, with your money, without your consent. The NHS you thought you had, the one your grandparents built, the one that was supposed to be there for everyone, is disappearing. And in its place, a logo on a building owned by someone else, run for profit, accountable to no one. That's not a healthcare system. That's a business opportunity, and you were never supposed to notice.